guys, Dr. Chelsea Smith here. What I wanted to talk about today is referral patterns that could be coming from your neck, even if you have no neck pain. So what does that mean? What does this kind of patient look like? So most of the time when I see people and I'm not sure if it's coming from their neck or somewhere else, things that they might say to me are, well, I started having this kind of weird pain in my arm, but it's not pinpoint tender to the touch. So when I try to move around and really get on it, I can't seem to get directly on it. And whenever I ask them things like, what exactly makes it hurt? They're like, well, nothing specific in my arm. I can't figure out what is happening. Sometimes I'll move a certain way and it zings me down the arm, or if I sleep on things weird, gets really uncomfortable. And every now and then I'll have this really weird sensation into my hand. So what I always ask my patients are, do you have any numbness, tingling, burning, lack of sensation, or any weird weakness that you might have noticed? And sometimes people have not really thought much about it, or they've not correlated the two, and they're like, well, now that you say that, actually, I did have numbness in these fingers. Or they might be like, I did have numbness in these fingers. So what I tend to do in that arena is I always go up to the spine first. So if you have any kind of arm, hand pain, and you do not recall an exact event where you just injured that tissue, I'm probably always going to screen your neck anyways. So what I want you to do is I want you to take a look right over here, and I want you to look at a chart that's going to show you certain places from the neck that actually are in charge of sensation and strength into the arm. Over here, when we are looking, if you can see right around, the actual shoulder area, that has a number by it, okay? And then as it goes down the arm, it has other numbers that correspond with it. What that is where in your neck, as you can see over here, where you see different nerves coming out of the spine. They go specific places in the arm. So even if you don't have neck pain, if you can look over here at this screen to see where some of these different patterns may be, that can help me start to develop a bigger picture of what's happening. I'm always looking for patterns, so I will test you on your strength. I will do a couple different nerve testings to see if there's a specific branch of it that might be more irritated than another. And then from there, you are going to have a better understanding. So I try to break it down what I find on you. So let's say you had weakness with maybe taking your arm out to the side. Maybe I tried to push down and you just couldn't fight me at all. So when I take a look at that, that looks a little bit more at C4-5, okay? And then what I might do is I might test you a little bit on sensation down in your forearm. And if you're like, you know what, that actually does feel different on one arm than the other arm, all of this is just gathering information so that I best know how to treat you. Hopefully that was helpful. I'm going to put a couple self-tips on how to self-assess. And then once we've worked on those self-assessment videos, that means you should have at least a very general overview of how to check a few things that might be coming from the neck and have a couple how-tos on how to move forward from there.